Today's clinicians face growing pressures to provide optimized care. Searching quickly for answers they can trust in the moment they need them can be demanding. ClinicalKey, the comprehensive knowledge discovery and everyday use clinical reference tool in one complete, unified and optimized platform. Designed to meet the diverse needs of healthcare professionals from research and education, with deep dive knowledge to practice, with rich drug references and actionable content. Move seamlessly from synoptic and actionable content, including pharmacology, to our extensive full-text journal and textbook reference, all in one complete evidence-based clinical reference tool. ClinicalKey is a dynamic, single source of support for the many decisions clinicians, nurses, pharmacists, and educators need to make, serving more use cases more often to help reduce variations in clinical practice and help improve patient outcomes. It draws on the latest evidence and continually refreshed findings, so clinicians can find the answer they need with speed and confidence. Explore deep insights to take your knowledge further with layered, comprehensive, evidence-based coverage of the issues clinicians face every day, including more complex cases such as rare diseases. Gain access to a world-class, diverse collection of leading full-text reference books. Narrow your search with filters to quickly pinpoint what you need. Deep dive within a textbook to view specific chapters, and capture to email or download the PDF. With a wealth of other extensive reference material, access journal articles, meta-analyses, randomized controlled trials, and narrative reviews. Capture articles. Subscribe to journals. Also, seamlessly save and add content to a presentation to enhance the teaching moment with a trainee doctor. Our deep dive references ensure healthcare professionals have access to the latest information to keep abreast of current developments and research in their respective fields. Actionable content for in-the-moment point of care. As a trusted second opinion and guide for clinical decision-making, ClinicalKey better positions clinicians to fully assess effective patient care factors and make treatment recommendations with greater precision. Starting with a suspected condition search, check key points from the clinician overview as a first pass against the patient history, and start to narrow a diagnosis or view alarm signs and signals if an urgent referral is necessary. Guided by the intuitive interface and arranged to follow a typical workflow, the clinician can check through helpful stages such as the approach to diagnosis, presenting signs and symptoms, lab tests and drug therapy to further assess the condition and treatment. Also, from within your workflow, access detailed drug monographs, check the right dosage, and see interactions and adverse reactions with integrated drug information from clinical pharmacology, enhancing your workflow to swiftly optimize, reconcile, and confirm a treatment plan. Download and print out condition and follow-up care information for a patient. ClinicalKey has a wealth of additional content types accessed through our intuitive interface to enhance your workflow. Thousands of videos and images to help diagnose and verify steps in a procedure. Quickly check calculations, classifications, and scores. Gain CME credits to help enhance professional practice and knowledge. Whilst our mobile app provides convenient access to the latest advances in clinical knowledge at your fingertips, on the go and at the bedside. to access Clinical Key, the single source, complete solution that's optimized to meet every clinician use case. Contact us today.
Hello and welcome to the Clinical Key video series. My name is Natasha and I'm the Customer Success Team Manager for Elsevier Health India. Today I'd like to share a little bit about hand, foot and mouth disease, but before I do that, allow me to introduce Clinical Key Physician. Clinical Key Physician is Elsevier's leading reference and decision support tool that allows clinicians access to clinical overviews, drug monographs, calculators, patient education, clinical guidelines, and a lot of synoptic content, which is so useful in making better care decisions for your patients. But apart from the synoptic content, Clinical Key Physician is a single platform where you can also access in-depth content like books, journals, videos, and multimedia, which is so powerful in supporting research and education at your institution. You can access Clinical Key Physician from any authorized network, and you will always have access to full text content as long as the network is authenticated. However, in addition to the full text content, Clinical Key Physician also offers a number of customization benefits, and that's why we encourage users to log in using a personal account. So I'm going to log into my account. And now coming back to the topic at hand, hand, foot, and mouth disease. Hand, foot, and mouth disease, as all of you may already know, had many outbreaks in India in 2022 and 2023, starting from Kerala, Kolkata, Lucknow, and then also in New Delhi. Prior to this, there weren't that many cases reported for hand, foot, and mouth disease in India. But in the last few years, with the increase in outbreaks and cases, we have now seen a lot of research coming out on this topic. So for example, if I wanted to look at research related to hand, foot, and mouth disease in India, I simply have to type hand, foot, and mouth India, and I start getting results. The search bar works very much like a Google search bar, where you can simply put key terms or key search terms that are on your mind, and you will get relevant results. So in this case, I want to look at journal articles on this topic. So I can use the menu on the left-hand side to filter my results for journal articles. As you can see, there are almost 400 results related to this topic. The first one is about a report from Udhampur in North India. There are many other articles. As an example, let me open this one on tomato flu, a new epidemic in India. Tomato flu is another name for hand, foot, and mouth disease. So here I can read the full text article. On the left-hand side, there is a table of contents. So if I don't want to read the full article, I can jump to a section of my choice. I can click on an image and view the image in full screen. At the bottom of the image, there's also the option to add it to a presentation. This is one of those customized options which is available when you create your own account. So by adding this to a presentation, the image will get downloaded into a PowerPoint slide with this citation information, and the image is already copyright cleared. So you can repurpose this image into your research, academic presentations, conference presentations, even outside your institution. I can even scroll back to the top of the article, see the details of this issue, as well as view a PDF version of this article. The PDF version looks very much like how the article would look like in the printed journal, and you can download these PDFs to your personal devices for your own personal use. But apart from research, as I mentioned, Clinical Key Physician can be used for a lot of other use cases. So for example, if I wanted to search for clinical information related to hand, foot, and mouth disease, I can simply search for this. As you can see, the search bar is already recommending some commonly searched terms. I'm not going to go into this. I'll simply search for hand, foot, and mouth disease. Because I have searched for a clinical condition, the first result is always the clinical overview. In this case, this is a clinical overview of the Coxica virus infections. As we know, hand, foot, and mouth disease is a category of enteroviruses called the Coxica virus. Now, I don't even need to read the full clinical overview. If I directly wanted to jump to, say, diagnosis, I can click on the pink pill. and I'll be taken to the diagnosis section. This clinical overview, especially the diagnosis, the treatment section, it's very useful for you to get quick answers at the point of care. So if you wanted to get actionable information to support your patients, you can quickly read the clinical overview, which is given in short bulleted text, but every single bullet is supported by the reference. So you know that all the actions that you're planning for your patient are evidence-based. Again, there are plenty of images to support your understanding as well. If you scroll down further to the treatment section, it starts with goals, disposition. It mentions some of the drugs, including the risks associated with some of the drugs. So for example, in this case, it says that we should avoid lidocaine and benzocaine for children because of risk of adverse reactions. It also talks about the risk related to diphenhydramine. At any point, if I want more information, I can even click on this to get more information on the drug in question. So as you can see, clinical key physician gives you answers very much like how a clinician would think. You might want to investigate about a disease if you're suspecting that your patient has it. And then when you're looking at a treatment plan, you may want to read more about the drug, and that's where it helps. So now I've come to human immunoglobulin 4 drug monograph. I'm on the section on indications and dosage. I can go back to the top of the page and see that this drug monograph is coming from gold standard. Or I can jump to a section of my choice. So for example, if I wanted to check for the global drug names, I can check what are the global drug names available for human immunoglobulin 4. In India, it goes by the name of histaglobulin. So it becomes very easy for you to identify your drugs. So in this very quick video, I've shown you how clinical key physician can support research using journal articles as well as point of care information such as clinical overview and drug information. As I mentioned earlier, there's also books available on clinical key physician. So again, for example, if I wanted to look at books related to infections, I can go to this book, Infectious Diseases. This is the entire table of contents. And from here, I can go into a chapter of my choice. And I can start reading the full chapter. So there are a lot of content types available on Clinical Key Physician. I'd encourage you to use the platform yourself. We'll explore all the other content types in other shorter videos. Whenever you have a clinical question, I encourage you to just simply post your question on this chat bar, and I'm sure you'll find relevant information. Thank you so much for your attention. Have a lovely day ahead.